Okay, good evening. Our topic tonight is Mycobacterium tuberculosis and other non-tuberculosis mycobacteria. So in short, we will be discussing Mycobacterium, the genus Mycobacterium. So among the Mycobacterium, there are two medically important. And one of those two is the most important, and that is your tuberculosis. Kaya siya bukod yung title. Okay? Now, um, this is the introduction. We shall discuss the following. So, the general characteristic of Mycobacteria, safety precautions, appropriate specimen collection and handling, laboratory procedures for isolation and identification of isolates, and clinically significant Mycobacterium species and the infections they produce. So this is the general characteristic of your mycobacteria. Almost all of the mycobacteria, okay? They are non-motile, slender, slightly curved, rod-shaped bacilli, and non-spore forming. So if I am going to ask you, uh, this is rod-shaped, this is bacilli, this should be gram o bonus. Ano siya? Gram positive, gram negative. Pagka kayo nagkamali pa dyan, ewan ko na. The cell has a high lipid content, the mycolic acid. Actually, the mycolic acid is the one responsible for the positive AFB staining or positive AFB reaction in acid-fast bacilli staining. Now, resist staining with gram stain. This is an acid-fast. This requires a complex media. So, medyo mataas ang requirement nito. Okay? Now, strictly aerobic. So, they only grow in the presence of oxygen. Slow growers, those associated with disease, takes 2 to 6 weeks to produce growth. Actually, maabot ng 2 months ang pag-grow ng inyong mycobacteria. So, if you are experiencing serious tuberculosis disease, kung ipapa-culture mo siya, baka patay na yung pasyente bago pa siya ma-detect. I had one case na he was a journalist, tapos very much he was isolated, tapos tinest yung sputum niya kasi negative yung x-ray niya, pero napaka-supurative ng phlegm niya, may dugo-dugo pa. So from the looks of it, talagang ano siya, tuberculosis. Tapos pina-culture yon sa laboratory. It took us 2 months to have the result. Tapos patay na yung pasyente. The M tuberculosis is enhanced by 5% to 10% carbon dioxide. So they are capnophilic. However, tuberculosis yun ha. You can culture that in the laboratory. However, the Mycobacterium leprae, this one fails to grow in vitro. So, mahirap siya i-culture in a laboratory setup using an artificial agar. M. leprae is of course the causative agent of your leprosy or ketong. Now, this is the usual clinical significance of Mycobacterium species isolate. So, lakihan natin. So, pathogen, ang Mycobacterium tuberculosis, Mycobacterium bovis, and Mycobacterium ulcerans. Often pathogen or can be a potential pathogen are the following: avium complex, the Mycobacterium avium complex. That's the Kansasii, Marinum, Haemophilus, Senope, Genevense. Okay. These are the potential pathogens. They are not really that pathogenic, but they have the potential to cause a disease. The abscessus, the chelonae, the fortuitum, malmoense, scrofulaceum, simiae, and zulgae. Now, usual saprophyte, these are rare pathogens. So, this is less likely to cause a disease. So, Gordonei, Flavescens, Gastri, Non-chromogenicum, Terrae, Flay, Smegmatis, Vaccae, and Thermoresistibile. Okay? So, those are just nice to know. The Mycobacterium tuberculosis complex, sabi may US pathogens, pero alam niyo, M. tuberculosis is more common in developing country. Okay? So, main US pathogens, they have classified these 3 Mycobacterium species to be their pathogens: the M. tuberculosis, the M. avium intracellulare complex, that's the MAC, and M. bovis, usually found in animals. Not usually seen in the United States, the M. leprae, which is the causative agent of leprosy, or also known as the Hansen's disease. Ulit, M. leprae, causative agent ng leprosy, Hansen's disease. If humoral immunity and not cell-mediated immunity. M. africanum, you cannot see it in the United States, so this can cause African tuberculosis. So, causative agent ng tuberculosis sa Africa, kaya M. africanum. M. microti, this one is not associated with any human disease. Kung mapapansin nyo, ang sabi dito, usually seen in the United States, simply because our reference is Mahon. Si Mahon, taga-states naman yun. Kaya, yung sinasabi niya. Okay? So, the Mycobacterium tuberculosis complex, clinical disease, you have primary tuberculosis. This is transmitted by airborne droplet nuclei. Infect the deep lung in the alveoli. Bacteria get phagocytized and continue to multiply. 4 to 6 weeks later, T cells sensitize and allow destruction of the intracellular bacteria, and then regression and healing of the primary lesion. Itong problema sa tuberculosis. Sabi dun sa inattendan kong seminar, tuberculosis, kung you will use the utensils of a person infected with M. tuberculosis, so mitibi siya, you cannot get infected. The only way that you can get the infection is by nasal droplets or airborne air transmission. Okay? Now, another thing, that is actually the danger. Kasi itong tuberculosis can resist extreme weather. Kahit umulan siya, kahit napakainit niya, it can still survive kahit hindi siya spore former. Kaya sometimes, be careful when you're walking down the streets, kasi sometimes there are some sputum or phlegm or laway na dinudura ng mga tao, and then you stepped on it, tapos iuwi mo sa bahay yung sapatos mo, di ba? Papasok mo, then the Mycobacterium tuberculosis, nandun na siya sa bahay mo. Kaya sometimes okay lang maglakad na nakatungo para maiwasan mo yung mga dura-durang yan. Okay? So that's the problem with tuberculosis. Now, how are you going to test for tuberculosis? Meron silang tinatawag na PPD. That's the tuberculin skin test. PPD stands for Purified Protein Derivative. This one is also known as the MANTOUX test. MANTOUX, ang spelling niya, MANTOUX. MANTOUX test. Okay? Now, there could be a reactivation. So, pwedeng gumaling ka, tapos in the future, when you get immune compromised, or you have malnutrition, or pag tumanda ka, pwedeng bumalik yung tuberculosis. Sa mga bata, ang tawag dyan, primary complex. So, karamihan sa mga bata na i-experience yan. Actually, ako, I had that disease. Tapos di gumaling. So, hindi malabong in the near future, pwedeng bumalik sa akin yon kung I'll get immune compromised. Actually, tuberculosis is one cause of death of HIV or AIDS patient. Now, you see the picture, this one. This is the growth of your Mycobacterium tuberculosis in Lowenstein-Jensen media. This is an egg-based media. Again, Lowenstein-Jensen, the LJ slant. Okay, the LJ media. We have this misconception that tuberculosis can only occur within the lungs or can only affect the lungs. But please remember that there are some extrapulmonary tuberculosis. So, meron tayong tinatawag na tuberculosis of the stomach, tuberculosis of the liver, tuberculosis of the intestines, tuberculosis of the bones, ganyan. We have miliary tuberculosis. This is the spread of bacteria from lungs to bloodstream. This one disseminates to other organs like spleen, liver, bone marrow, kidney, adrenal glands, and eyes. So, tingnan mo naman, magkaroon ka ng tuberculosis of the eyes. Yeah. Occurs most often in children, okay? Also, in HIV positive patients, okay? So, you call that miliary tuberculosis. Less common, pero may mga ganyang cases. Katulad nung minsan nahawakan ko. When I was in medicine, ang patient ko ay may POTS disease na. POTS disease, there is a tuberculosis of the bone. Okay. We also have your genitourinary tuberculosis. So, ano yung mga affected? Bladder mo affected, diba? So, the UTI-like symptoms with sterile pyuria. Okay? Skeletal tuberculosis, at sinasabi ko kanina, patient ko, POTS disease. Okay? Yung buto kasi yung affected. Back pain and involvement of the hip and the knee. Usually, kapag ang patient mayroong tuberculosis of the bone, hindi na sila nakakalakad. Treatment. Noon, 6-month course of therapy lang siya. Pero, in-extend nila up to 9-month course of therapy. So, the therapy is actually composed of the isoniazid and rifampin and other drugs. If it is resistant, you may use kanamycin and ciprofloxacin. Also, some would use sulfamethoxazole. Basta lagi magka-partner yung isoniazid and rifampin. Okay? Hindi pwedeng isa lang. Treatment failure. So, when the treatment becomes ineffective when the patient is non-compliant. And if you have contracted the drug-resistant Mycobacterium. For MDR-TB, that's multi-drug-resistant tuberculosis, the recommended treatment is the second-generation aminoglycosides and fluoroquinolones. While XDR-TB, treatment is combination of several drugs. So, hindi lang siya aminoglycosides and fluoroquinolones. There is one that has been documented to have this MDR-TB. May isang Pilipinong nag-positive dyan. Pero ngayon, sabi okay na. Buti na treat. Kasi if not, nag-progress siya sa XDR-TBI. They see you soon. Okay. Next. Mycobacterium bovis, not of that great importance because primarily this is found in the cattle. However, kung ikaw ay nag-aalaga ng mga cattle, tapos may dogs ka infected then cat swines and parrots, then it could also infect humans, which causes symptoms is similar to M. tuberculosis. The reason why sometimes we don't allow dogs, cats to lick humans kasi kahit, sabi ko nga, kahit na gwardyado yan ng vetmed, the possibility of having the disease that hindi mo naman sila nababantayan is very much possible. Now, the MAC, the Mycobacterium avium complex. The Mycobacterium avium complex is actually slow-growing also, same as with your M. tuberculosis. This one is commonly found in the environment. So, ubiquitous in nature siya. Soil and water. This causes disease in swine and poultry. Large increase in number of isolates due to HIV positive patients in developing countries. HIV positive patients in developing AIDS. Okay. So, technically, hindi kasi siya common kung makikita mo siya swine and poultry lang. Pero, nagiging common siya kasi tumataas na yung rate ng persons with HIV that is developing to AIDS. Tapos, nakocontract nila yung infection. So, the MAC or the Mycobacterium avium complex causes pulmonary disease that resembles TB, yung cough, fatigue, weight loss, low-grade fever, and night sweats. You have cavitary diseases, tapos may develop into disseminated disease. Again, this is most common isolate of systemic disease in AIDS patient. The problem with Mycobacterium avium, this one is resistant to TB drugs. So, kahit gamitan mo siya na rifampin and isoniazid, although this is not an MDR, kahit gumamit ka ng higher concentration and combinations, parang ineffective, parang ang bagal pa rin ng paggamot sa kanya. Now, these are the other slow-growing species. You have M. avium, subspecies paratuberculosis. You have M. kansasii, M. asiatica, M. celatum, and M. gastrii. You have your M. genevanse, M. gordonei, M. hemophilium, M. malmoense, and M. marinum. Ito marinum, nakakatuwa itong marinum eh. Sorry. The marinum species, you can find this in the swimming pools, yung mga hot springs, ganyan. Kaya, pansinin nyo, this can cause itchiness eh. Sometimes when you dip into the pool, lalo na pag summer, syempre di naman agad-agad nalilinis yun. Nangangati ka. So, it's Mycobacterium daw. Mycobacterium marinum. M. scrofulaceum, M. simei, zulgai, M. terrae complex, M. ulcerans, and M. cenope. Slow-growing species. Now, these are the photographs of your Mycobacterium. Okay, let's enlarge. This one is Mycobacterium marinum on Middlebrook 7H10. Again, Mycobacterium marinum on 7H10 medium. This one is Malmoense in Middlebrook 7H10 medium. Malmoense. And this one is Mycobacterium scrofulaceum on Lowenstein-Jensen medium. Now we have rapidly growing species, the M. chelonae, M. fortuitum group, M. flay, M. smegmatis complex, and M. leprae. So, let's discuss Mycobacterium leprae because this is one of the most clinically significant Mycobacterium. Causative agents of Hansen's disease or leprosy. There are two forms of the disease. Meron kang tuberculoid leprosy, meron kang lepromatous leprosy. Yung tuberculoid leprosy, there is a skin lesion and nerve involvement. Tapos, spontaneous recovery. So, gagaling ka naman ng kusa, no? However, your lepromatous leprosy involves skin lesion and progressive nerve damage. Slowly progressive and eventually life-threatening. This one is more serious than your, teka nilanggam. Serious than your tuberculoid leprosy. If it involves the nose, then this can cause deformities. Ito yung itsura, yung saddle nose deformities. Nauubos yung ilong. Okay? There's no other way to diagnose this but by skin biopsy. Yun yung kinikwento ko na meron akong classmate dati sa med, pang Mr. Med siya. Tapos yung kanyang tenga, makate, yung lagayan ng hikaw, yung pina, the ears, ate, laging maga. Tapos sabi sa kanya, pa-check mo kaya yan. Nung pina-check niya, positive siya sa ketong, tapos kinetong na siya. You're asking me if there are cases nowadays? Yes, I have talked to a nurse when I was applying for visa in Korea. Nakausap ko siya. Nurse siya ng Tala. That is a leprosarium which is situated at Quezon City. At nakapagtataka dahil marami sa Quezon City ang merong leprosy. Okay? This is the skin biopsy of your M. leprae. Enlarge natin. Oh, okay. So, there's a destruction of the epithelium. So, let's now go into safety consideration. For your personal safety, syempre wala namang iba kundi PPE. And please remember that your handling of Mycobacterium tuberculosis is now regulated. It is a must that when you want to isolate M. tuberculosis, you have to use biosafety cabinet level 2A. Okay? So, if a person or if a medtech usually works in TB dots or in TB lab, that medical personnel or that laboratory personnel should be monitored regularly. Okay? For skin test. So, masakit pa naman yung skin test. Now, the ventilation. The TB lab should be separated from the rest of the laboratory, which is the common mistake of the common laboratory in the Philippines. Pinagsasama nila yung basta bacti, pasok na dyan ang TB, but it should be different from the bacti lab, okay? Non-circulating ventilation system, 6 to 12 room air changes per hour, so it should be at the negative air pressure. No air shall come in, no air shall come out. Biologic safety cabinet to prevent aerosols, yung sinasabi ko, biosafety cabinet 2A. Proper installation of maintenance test for performance and the contamination of surfaces by using disinfectant and UV light. Okay? So, use of proper disinfectant is very much encouraged. Cover surface in towel or absorbent pad soaked in disinfectant. This reduces the aerosols, yung mga air droplets. So, what are the types of disinfectants that you should use? Phenol soap mixture, sodium hypochlorite as a classical, a very classic disinfectant. Sodium hypochlorite of 1:10 dilution or 1:50. That would mean 10% sodium hypochlorite. Very effective disinfectant yan. Formaldehyde of 3% to 8% and phenol of 5%. Other precautions, you should not use a reusable loops. Rather, you should use a disposable loops. PPE, of course. Actually, yung face mask, hindi lang normal na face mask yan. You have to use the N95 as per recommendation. So, acceptable specimen, respiratory specimens, expectorated sputum, normal saline nebulized induced sputum, transtracheal aspirate, bronchoalveolar lavage, and laryngeal swab. Noong unang panahon, pag pinagko-collect namin yung patient, dapat wala pa siyang naiinom, di pa siya nagtututbrush, deep cough, ayun, expectorated sputum. But, since yung patient is not, kumbaga, tawag yun, parang comfortable in doing that, tas hirap na hirap pa pagka deep cough, ang ginagawa ngayon, ninenebulize muna. Ang pagkakamali lang ng ibang doktor, ninenebulize nila using yung mga Ventolin, yung mga salbutamol. But, ang recommendation actually is when you nebulize, you just have to use your normal saline solution. Kasi daw, normal yun yung isotonicity. Because the tonicity of the nebule could affect the cellular structures of your Mycobacterium. Okay? Now, you should also accept other body fluids like pleural fluid, gastric aspirate, cerebrospinal fluid, stool, or urine. Why? Because there are extrapulmonary tuberculosis. Siguro, kinoconsider din ng doctor yung extrapulmonary tuberculosis. Okay? Body tissues like blood, bone, and skin could also be accepted. Okay, so this is the table found in your book. The acceptable specimen for processing. Teka muna. Pag tayo nangungulekta, before, 3 days consecutive. Pero ngayon, pag yung 3 days consecutive, early morning, okay? Ngayon, tinatanggap na po ng TB dots yung, and as per recommendation of the World Health Organization and other research lab, yung early morning and then same day, spot. Ibig sabihin, nung kasi, 3 araw, kunyari, nag-collect ka ng Monday morning, early morning, babalik ka ulit ng Tuesday, early morning, tapos babalik ka ulit ng Wednesday, early morning, basta 3 consecutive days, na kapag hindi mo natapos, ulit ka na naman sa umpisa. Ngayon, pwede na yung early morning and then spot, same day, early morning, tapos yung spot, ibig sabihin, actual, kunyari, lunch ka, bago mo mag-lunch, mag-produce ka, sige, pasa mo na yon. Tapos sa hapon, pasa ka ulit ng iba. Okay? So, pwede na ngayon yon. Now, how to process your phlegm? You have to do digestion and decontamination process. Now, here are the agents that you should use. The sodium hydroxide or NaOH at 2% or 3% or 4% will do. This serves as a decontaminating agent and digestant. So if you want to know the procedure, refer to 26-1, which is found in your book. And now C or NALC. This is N-acetyl L-cysteine. This one serves as liquefying or mucolytic agent. Others use benzalkonium chloride. This one helps to digest and decontaminate as well. And oxalic acid, used to decontaminate P. aeruginosa and cystic fibrosis patients. Okay. So, after decontamination and digestion, we now go to concentration procedure. Mycobacteria, there is a low specific gravity. This one needs a high-speed centrifugation to be concentrated. Slow feeds would really take longer and expose bacteria to toxic chemicals longer. Particularly important with large volume specimen. Treatment of sample with mucolytic agents, it helps pellet the bacteria rather than mucus. So we have special staining requirements. You have an increased lipid content, irregular uptake of gram-positive. So, like gram-positive, if at all, with beaded appearance. So, acid-fast staining, you have your 2 methods, Schell-Nielsen and Kenyon method. For Schell-Nielsen, this is the hot method. Carbolfuchsin is the primary stain while heating, and then you have to decolorize it with an acid alcohol and counterstain it with methylene blue. Kenyon is different from the difference between your Schell-Nielsen is you do the same thing, however, there's no heating that is required. And the counterstain used in Kenyon is malachite green. Ito na ngayon. Special staining requirements. The auramine or auramine rhodamine fluorochrome stain. You have to use a dark microscope. Call it dark microscope, no? O bright field microscope. The background is black. Tapos, yung inyong Mycobacterium tuberculosis will fluoresce para siyang umiilaw talaga na kulay orange na bacilli siya. Okay? Actually, the auramine or auramine rhodamine fluorochrome stain is highly recommended by World Health Organization and actually is being encouraged to be used nowadays. Kaya lang kasi mahal yung microscope, yun ng regular na microscope, para pa tayo makabili yung pangmamahalin. Okay? So, this is the acid-fast smear interpretation. You just have to familiarize yourself, okay? Pero ang alam ko, this has been changed by the World Health Organization already. Now, I just have to update you with the latest acid-fast smear interpretation. But for now, let's just settle what was written in Mahon. Now, here are some culture medias that you may use for the isolation of Mycobacteria. You have your Lowenstein Jensen media. Usually, this is prepared in slant. Okay? Tube siya, tube. Agar siya. This is composed of eggs, salts, glycerol, and potato flour. Eggs, so protein. Okay? You don't use a normal autoclave in sterilizing your Lowenstein Jensen media. You have to use the Arnold sterilizer. Okay? The Arnold sterilizer has a lower temperature. Kasi siya ay egg-based. Ay di lower temperature ang kailangan niya. Otherwise, magko-coagulate yan, madidenature ng protein. So, kung 3 consecutive days siya in a lower temperature, 3 consecutive days mo siya i-autoclave. Otherwise, kung mamimiss mo ang isang araw, ulit ka na naman sa umpisa. The purpose of autoclaving in a low temperature, nasabi ko na, ay to prevent it from denaturation. And the purpose of 3 consecutive days is to complete the sterilization process. Otherwise, hindi magiging healthy yung inyong media para doon. However, your Middlebrook media and your Middlebrook media is more commonly used nowadays. Okay, it has many factors. It has oleic acid and serum that encourages the growth of your Mycobacterium tuberculosis. Yung Middlebrook media, actually, ito yung pwede mo siyang, if I am not mistaken, this is not egg-based kasi. So, pwede mo siyang i-autoclave gamit yung 121 degrees C at 15 PSI for 20 minutes. American Thoracic Society, the ATS media, this one is similar to LJ media, only that this has no salts. Okay. By the way, your Middlebrook media, meron kang Middlebrook 7H10, 7H9. Pag sinabi mo Middlebrook 7H9, it is in broth form. Liquid siya. Kapag ka 10, it is in agar form. And meron ka rin Middlebrook 7H11. Okay, agar din yun. So, all media has malachite green. Okay? Yung malachite green, it doesn't act as a dye or a staining agent. Rather, your malachite green suppresses the growth of gram-positive organisms. So, actually, that makes your Mycobacterium media a selective media, as it suppresses other gram-positive and only supports the growth of your Mycobacterium. You have your septic check system, the paddle and liquid media. Paddle has Middlebrook agar on one side. LJ media and chocolate agar in separate regions on the other side. Chocolate agar to detect some fastigious or species like M. marinum and M. haemophilum. Also, you have your isolator lysis centrifugation system. So, these are some mycobacterial culture. Please have a chance to give yourself a chance to check on the composition of each agar. Oh, that's the difference of 7H10 from 7H11. Pareho lang halos sila. Both are agar. Only that your Middlebrook 7H11 has 0.1% of casein hydrolysate, which is wala doon sa inyong 7H10. Okay? meron pang 7H13. Okay. Now, levels of service defined by the ATS and the College of American Pathologists. Never mind this part, okay? But just read it for nice to know. So for the identification of Mycobacterium, again, it is an acid-fast organism. The colony morphology, two general types. We have the smooth and soft. We have rough, sometimes with a fried egg appearance with dense center. The Mycobacterium tuberculosis cording, yung serpentine factor actually nila. Yung pag sinabi natin cording, mahaba kasi yung Mycobacterium na yan. They are capable of connecting themselves and then para silang mahabang linya. Actually, that is one of their virulence factor. Yung serpentine cord factor. Mycobacterium intracellulare gives you a fried egg appearance. Okay. This is your schematic diagram for slow-growing Mycobacterium. Okay. So, pigmentation in the absence of light. Okay. Buff. Pigmentation after exposure to light. Meron kasi tayong photochromogens kung tawagin. Pag sinabi natin photochromogens, pag walang ilaw, wala silang kulay. Kapag inilawan mo, sila ay magiging color yellow. So, actually, hinahanap ako. Talaga ba? Because I'm looking for Kansas City. Kansas City turns yellow actually. Yeah. So, it's photochromogen. Nakita ko na siya. So, tama yung si Mayhon. May plano pa pala akong maliin si Mayhon. So, pigmentation in the absence of light, you have to classify the buff and the orange. So, if it is buff, you check if there is pigmentation after exposure to light. Pag naging yellow siya, after exposure to light to the nitrate reduction. If it is positive with nitrate reduction, you do the twin hydrolysis, which should be positive, and SQ catalase, which also should be positive. And that would be your Mycobacterium cancer-CE. Dinidiscuss ko ito, ibig sabihin, importante ito Now, if in nitrate reduction, nasa yellow pa rin tayo yellow. If in nitrate reduction, nag-negative siya, then you have to do the SQ catalase. Pag positive siya sa SQ, proceed with twin hydrolysis. Kung positive sa twin hydrolysis, you have Asiaticum. If it is negative, then it is Simiae. Now, kung negative sa SQ catalase, then therefore, you have isolated Mycobacterium marinum, which has an optimum growth at 30 degrees C. Take note, this is formation of yellow pigment. Then you proceed with nitrate reduction test. And if it is negative, you proceed with SQ catalase test. Ganun. And then, after exposure to light, buff pa rin yung kulay niya, you do the niacin test. If it is positive, you do the following, and then if it is negative in 68 degrees C catalase and SQ catalase negative, nitrate reduction positive, it is tuberculosis. Okay? If in niacin negative siya, proceed with twin. That's twin 80. If positive, proceed again with nitrate reduction test. Positive, you proceed with 68 degrees C. Ang daming ginagawa. 68 degrees C catalase. If it is positive, then it's stearate triviale. If it is negative, you proceed with SQ catalase. If it is positive, you proceed with 68 degrees C catalase. Positive, Mycobacterium non-chromogenicum. Okay. Teka, nalito na ako. Yun nga. And then, ganun din, same thing. Now, if there is pigmentation in the absence of light, and then it's orange, you proceed with twin hydrolysis test. Okay? You divide them into positive and negative. Kung negative siya, orange siya, twin hydrolysis negative siya, edi scrofulaceum siya. Pero kung positive siya, tapos you proceed with nitrate production. Then check if it is protocomogen at 22 degrees C. Then it could be, if it is positive, then it's sulgai. If it is negative, then it's flavescens. If it is negative in nitrate reduction, it's Gordonay. Okay? Orange, negative in nitrate reduction, Gordonacea. Okay? So, diagram of slow-growing Mycobacterium. Growth rate, 3 to 7 days on LJ at 37 degrees C. You have to do the 3-day aryl sulfatase test. If it is positive, you proceed with nitrate reduction. Then, if it is positive with nitrate reduction, it's fortuitum. If it is negative, then it's chelonate. Okay? Now, sa 3-day aryl sulfatase test, if it is negative, you check for the pigment. If it is buff, then you classify it by colony. If it is rough, it is smegmatis. And if it is smooth, then other species of Mycobacterium. Now, sa yellow to orange siya, ang rough niya, fillet, and kapag smooth, vacay siya. Okay? So, growth rate characterized by growth in less than 7 days, rapid growers. More than 7 days na, slow growers. So, most important pathogens under slow growers is your M. tuberculosis, M. bovis, and M. avium complex. Temperature sometimes help narrow species. Ito na yung sinasabi ko. Photoreactivity. We can classify them into photochromogens. Okay, photochromogens. Scotochromogens and non-chromogenic. Photochromogens, carotid pigment upon exposure to light. Scotochromogens produce a pale yellow to orange color. And non-chromogenic, buff or lack of color. Di ba, ay buff yung ating M. tuberculosis. Okay. Non-chromogen, non-photoreactive in light or dark condition. Photochromogen, non-pigmented until addition of light. So, yung photochromogen, pag walang ilaw, sila ay walang kulay. Pero kapag inilawan mo na sila, nagiging yellow, nagiging orange. So, they are photoreactive. Scotochromogen, this one produce pigment naman both in light or dark conditions. Okay? So, ito yung photoreactivity of clinically important mycobacteria. Please familiarize yourself also. So, biochemical identification. Niacin accumulation. Most mycobacteria convert niacin to ribonucleotide. Okay? M. tuberculosis convert to nicotinic acid. Cyanogen bromide and aniline produce a yellow color. Okay. This is an example of your niacin test. So, the one is, this one is positive. Meron siyang, meron siyang yellow color production. Okay. Tama. So, niacin is converted to nicotinic acid. Ito yung kanyang reagent, yung, indicator. Cyanogen bromide and aniline. Which, upon reaction, yun na. Biochemical test, nitrate test, production of nitroreductase reduces nitrate to nitrite. Positive to this test is M. cancer-CE and M. tuberculosis. Positive ha, nitrate to nitrite. Positive, M. cancer-CE and M. tuberculosis. So, this is your nitrate reduction test. This is the negative control, 1+, 3+, and 5+. Ito yung mga positive reaction. Catalase. Enzyme splits hydrogen peroxide into water and oxygen. Tests hit stable catalase at 68 degrees C. You just have to add twin 80 as a detergent. Your twin 80 serves as your surfactant. After 5 minutes, you measure the column of bubbles. Record less than or greater than 45 millimeters. Ayan po. Diba? Catalyst. Semi-quantitative siya. Einstein yan. Other tests, you have your hydrolysis of twin AD. As I've said, this is a surfactant simply by detecting lipases. Iron uptake, convert ferric ammonium citrate to iron oxide. Positive result is rusty brown color. Aryl sulfatase hydrolyzes the bond between sulfate group and aromatic ring structure. Pyrazinamidase hydrolyzes pyrazinamide to pyrazinol acid and ammonia. Okay. So this is an example of your iron uptake test. This is an example of pyrazinamide test. Other biochemical tests, you can use tellurite reduction, reduce potassium tellurite to tellurum. Positive color, black. Urease, release ammonia. Positive color, pink. So this is your tellurite. Ito yung positive. Yung black. This is your urease test. Positive pag nag-pink siya. Inhibitory test, you have NAP. Inhibits M. tuberculosis complex. TCH thiophene 2, may kasunod pa yun. Distinguishes M. bovis from M. tuberculosis. M. bovis is susceptible to TCH. Okay? Resistant to tuberculosis. Sodium chloride tolerance inhibits most mycobacteria. M. flavescens and M. triviale will grow on your sodium chloride. Growth on MacConkey agar, M. fortuitum chelonae complex can grow on MacConkey agar without crystal violet. So you can do your HPLC, yung high performance liquid chromatography, but medyo madugo na ito. Marami naman pwedeng ibang mas madaling gawin. However, ginagawa ko minsan, HPLC of the mycolic acid. This is a long chain fatty acid. Need to extract mycolic acids, but not too difficult. This one can detect all species. Hybridization and test commercial probes. Probes are specific and need to use several to detect species. You may do automated DNA sequencing, 16S, or rRNA PCR. Ngayon, tinitignan na rin. Actually, meron na si feed. Si feed has been recommended by TB dots to be used. Actually, most of the TB dots has this what do you call this, the CFID. Kaya lang mahal yung susceptibility. This one is very difficult because it requires an experienced and trained staff, plus not to mention the long tawag ito, incubation period. Pero ito, ginawa ko na to, nakalimutan ko na paano ginagawa eh. Actually, hindi siya yung typical na antimicrobial testing na ginagawa. Four-plate technique, tapos bibilangin mo yung colonies na mag-grow sa kanya. Pagka may nag-grow na more than one, resistant yun. Parang ganun. Colony sa binibilang, hindi zone of diameter. Proportion method, absolute concentration method, or radiometric method can be used. Tapos, merong special agar na ginagamit dito eh. Sa susceptibility testing ito. Ano ba yun? Nakalimutan ko. Ogawa agar yata nga. Anyway, I will just have to inform you. I'll ask the one that is more expert on this. Okay. So these are the other anti-tuberculosis drugs and concentration. Immunodiagnosis, skin testing, and serology. And we're done. Okay. Basta yung sa Hansen's disease, just remember, it can be seen in foot pads of the armadillo. Yung pangolin, yun. Possible carrier sila ng M. leprae. Hindi masyadong diniscuss ang M. leprae because Usually, it's done with skin biopsy for the determination. And yun lang naman yung clinical symptoms niya, yung deformities, no? Yung mga parang sugat-sugat. So, does it heal? Yes. By the way, treatment for your M. leprae, yun din, yung mga ang ginagamit sa kanya, Dapsone. Dapsone yung ginagamit sa kanya as treatment. Okay? So, meron akong isang question dito, plus 1 yan. So, you just have to answer and comment to this video. Okay? Good night, everybody.